if I have a feeling, for instance, that there is disease progression, maybe the patient doesn't show this in a significant way, but maybe there's just a few hints that there could be something happening where their disease is growing, I would then approach the physician or other team members to say, maybe it's time to kind of think about scanning them a little earlier than we would have anticipated, knowing that maybe they have a few subtle symptoms, the pain is a little bit worse, or their markers are creeping a little bit. At that point, I think that that's part of my job, is to alert the physician to what I feel is going on, so that we can maybe make some earlier interventions to the patient's care, so that we can stay ahead of the game, so to speak. So I feel that and also when there's treatment decisions to be made, I'm in the position where I can guide the physician on what symptoms the patient's already suffering from, so that when we're making further treatment decisions, we're choosing, making decision or choosing drugs that wouldn't potentially exacerbate some of the symptoms that they're already suffering from. Regarding their disease, most of the time the physician has already reviewed CAT scans with the patient, reviewed the treatment plan. A lot of times I'm there as the reinforcement. Thinking about the situations as they come, patients ideally only retain minimal 10% of what we tell them. So a lot of times when I come in as the second guy in line, things are still sinking in. So I often have to review everything again, because it's such a shock. I have cancer and it's spread, or it's hard to grasp. So it's great when they have other family members there, so that we kind of another couple sets of ears, so to speak, so that they can help retain some of the information. But ideally, I would say that the physician is the lead. So the physician sets the treatment plan, reviews their disease, has the treatment plan. I come in as the reinforcer on what happened, what's going to happen, where's the disease, how big is it, how many places did it go, that kind of thing. So regarding their treatment decisions, that I feel that the physician ideally makes the decision, but I definitely am also there to guide them regarding any kind of, if they have a comorbidity, if they're diabetic and they already have issues with neuropathy, there might be some agents that we might not initially start with that would exacerbate those kind of symptoms that they already have. So I definitely am part of the team regarding the treatment decisions as well.